Hello friends, I'm Jyoti Hikod and today I'm going to talk about the vital signs. So let's start. Now, what are the vital signs? Vital signs describes the procedure used to assess the vital signs that are temperature, pulse, respiration, and blood pressure. Identify factors that can influence each vital signs. Identify equipment routinely used to assess the vital signs. Then identify rationales for using a different routes for assigning a temperature. Then take a vital signs and interpret the finding. Then the document the vital signs. Then we see the vital signs in a cardinal signs. Vital signs reflects the body physiologic status and provide information critical to evaluation homeostatic balance. It includes temperature, pulse, respiration rate, or blood pressure. What are the purpose of vital signs? The purpose of vital signs are to obtain the baseline data about the patient conditions. Then the second one is the diagnostic purpose, and the last is for therapeutic purpose. Then we see the equipment used in vital signs. The equipment used in vital signs that are the vital sign tray, stethoscope, then a signomanometer, then thermometer, the second hand watch, then red and blue pen, pencil, then vital sign sheet, cotton wab in bowl, and then again a disposal gloves if available, and a dirty receiver, kidney dish. That are all the equipments used in vital signs. Then we go forward to a time to access the vital signs. On admission to obtain a baseline date when a client has a change in health status or a report symptoms such as chest pain or fainting, according to nursing or a medical order. Before and after the administration of a certain medication that could affect respiration rate or BP, that are respiratory and cardiovascular systems, before and after surgery or an invasive diagnostic procedures. Then before and after any nursing interventions that could affect the vital signs. For example, ambulations. According to hospitals or other health institution policy. Then we go forward to first is the temperature. Temperature, it is the softness or coldness of a body, is the balance between the heat production and the heat loss of a body. The normal body temperature using oral 37 degrees Celsius or 98.6 degree Fahrenheit. There are two kinds of body temperature that are core temperature. The first is core temperature. In that, it is the temperature of internal organs and is remain constant most of time. That is 37 degrees Celsius with a range of 36.5 to 37.5 degrees Celsius. It is the temperature of the deep tissue of a body. It remains relatively constant always, and it can be measured by thermometer. Then we go forward to a second one, that is a surface temperature. That is the second type. In a surface body temperature, we defined it is as a it is the temperature of a skin, subcutaneous tissue and fat cells. It rises and falls in a response to the environment. It ranges between the 20 to 40 degrees Celsius. It doesn't indicate the internal body or physiology. Then we go forward to the alteration in body temperature. So what are the alteration in body temperature? That are the normal body temperature in humans are 37 degrees Celsius or 98.5 degrees Celsius degree Fahrenheit. The range is 36 to 38 degrees Celsius or 96.8 to 100 degree Fahrenheit. The body temperature temperature may be abnormal due to a fever. It means a high temperature, or hypothermia means a low temperature. Then pyrexia fever, a body temperature above the normal range, that is like 38 degrees Celsius to 41 degrees Celsius, or 100 degrees Celsius to 105 degree Fahrenheit. And then the second condition is hyperpyrexia, in which a very high fever such as 41 degrees Celsius greater than 42 degrees Celsius leads to death. Then the third condition is the hypothermia, in that the body temperature is between the 34 degrees Celsius to 35 degrees Celsius, less than 34 degrees Celsius is a death. Then we go forward to a common types of fevers. The common types of fevers included intermittent fever, remittent fever, relapsing fever, and constant fever. Firstly, we see the intermittent fever. In intermittent fever, the body temperature alternates at a regular interval between the period of a fever and a period of normal or a subnormal temperature. Then the second type is remittent fever. In remittent fever, it is a wide range of a temperature fluctuation. Fluctuation, it means more than 2 degrees Celsius, occurs over 24 hours period, all of which are above normal. Then the third one is a relapsing fever. The short febrile periods of a few days are interspersed with a period of 1 or 2 days of a normal temperature. And the fourth one is a constant fever, in that a body temperature fluctuates minimally, but always remain above normal. Then we go forward to the factors affecting body temperature, that are age variation, diurnal variation, then exercise, hormones, stress, and the last one is environment. That are all about the vital signs. Thank you.